Hi, Ingrid. Nice to see you again.
Hello there.
I wanted to ask you a couple of questions around the topic of diabetic retinopathy. I don't know of very many people that have as much experience as you do around this topic, especially around screening for diabetic retinopathy. Can you tell me sort of how long you've been involved and under what capacity you were involved with diabetic retinal screening?
So we have been involved with a telemedicine program to remotely assess for diabetic retinopathy since about 1999. And so we've done this for quite some time with the idea being to try to capture those patients who have diabetes that are not going in to see their ophthalmologist for their regular evaluation as is recommended really by all of the leading professional societies that are dealing with patients that have diabetes.
From my perspective, even when I did my fellowship back in the early 90s, based on the ETDRS, DRS studies, and all these diabetic studies that we've done, great treatments, we were able to save 90% of our patients if we got them early enough. There were 10% of patients that were a challenge, and I think we're changing that game as well. So you've been very, very involved with this. How have we been able to move that needle, in the last 20, 30 years, in terms of screening rates, do you think?
Well, the wonderful thing with diabetes is that we're doing a better and better job at being able to treat patients who have disease so that we can keep them from losing vision. The unfortunate thing is that if we don't see these patients in a timely manner before they lose vision, then it doesn't matter what wonderful treatments are available, they're not going to get them. And really, for as long as I can remember, certainly for 3 or 4 decades now, in the United States, the rate of screening or assessing for diabetic retinopathy has been roughly holding steady at about 50%. And so that means that half of all patients with diabetes are still not getting the recommended screening. That's in spite of all the efforts that we've put out through the American Academy of Ophthalmology, through the American Diabetes Association, through the primary care family practice associations. In spite of all the efforts, if you look at the rates of patients with patients with diabetes that are being screened, we're still not getting about half of them. With the new technologies that we have available, we feel that using technology where we can remotely capture images of patients, of the images of their retinas, we now have an opportunity where we can perhaps get to those patients that we currently aren't seeing in an ophthalmologist's office. If we can identify them in the primary care setting, and most patients with diabetes do go see their primary care physician, even though they may not see an ophthalmologist, if we can capture them there and identify the fact that they have disease, then we can hopefully get them in and treat them before they have advanced vision loss.
Completely agree with you.